one of our goals is also to make people aware that this scenario is present.
Instead of sort of waiting and trying sort of all the usual things, why not address one of the major problems that you can actually do something about?
If they're looking into our product, we can pretty much promise them that they will be bending less circles getting in foal and also getting more foals. If you work with brood mares as a vet or owner, you have surely met the problem mare, trying to get that mare pregnant, only to end up with no result and big disappointments. What if we told you the answer might be something you have overlooked? In this podcast, we will explain you how 80% of your problem mares easily can get back in foal. Welcome to From Headache to Hope, and cover the secrets behind problem mares and how you can turn things around. My name is Martin. Today we're diving into the mystery. Joining me today is two of the leading minds in equine fertility, Professor Miki Bojesen and Dr. Morten Rønn Petersen, equine specialist. Make your own introduction. Morten.
Yeah, thank you. Hi, my name is Morten Petersen, and as mentioned, I'm a vet, and I've worked with fertility for many, many years now. In vet school, I did a final project on equine reproduction and worked in clinical practice on a very large stud farm, and that led me to do a residency in the US, in Davis, California, which I enjoyed a lot. And when I did a PhD afterwards in the University of Copenhagen, I joined up with Miki and did a lot of research in endometritis in mares.
And is it wrong to call you a specialist or repo specialist?
No, that's good.
Yeah,
Thank
fitting.
You. That's fitting, yeah.
And Miki?
Yeah, I'm Miki Bojesen, and I'm a professor at the University of Copenhagen. I'm a professor in microbiology. I'm also a vet, but I work with microbiology and infections in various animals, especially horses, for quite a long time. And as Morten said, we have been doing a number of projects together.
So just to get more precise, what the listeners is going to get by spending an hour together with us. A problem mare. Can you give some brief, what is a problem mare? I know it's a third time, and then it's in the category.
Yeah, that's if you look at the clear, you can say the definition of a problem mare, being bred 3 times without getting in foal. A lot of the mares that we have looked at have been bred more than 3 times, with fertile semen and still haven't gotten in foal. Our work has primarily been on infectious endometritis, especially the chronic cases, looking at these hidden infections.
And Miki, at one time, they will be pronounced as barren.
Yes. So these are the mares that are, where the people have tried over and over again, get them in foal, and maybe they get them in foal, but they lose the pregnancy. So they keep being empty or barren in the reproductive season, and some of them year after year.
And my unqualified guess is that they're spending a lot of money on these mares.
A lot of these mares are actually looked after very much. So a lot of them will have seen a reproductive vet several times, and also have been, through series of they try to find out what's actually the reason for them not conceiving, and various treatments, both antibiotics, not antibiotics, a lot of different things over and over again. So it's a very costly mare, a mare that is barren over a long time.
I guess it could also be quite painful if you knew that the last foal the mare got was $100,000 worth, or
even more.
Yeah.
Even more bloodline that is extremely important for the breed, etc., etc.
Yeah.
So, yeah.
And I know you guys have looked very closely at these mares for 10 years, 20 years?
20 years, I think.
Yeah.
20 years.
We are aiming at.
Yeah.
Getting a little gray.
So these problem mares, if you take 100, like just a mix of your breeding brood mares, out of 100 when starting the season, how many will end up in the category of problem mares?
It will, a little bit depending on the age profile of your mares, it will be somewhere between 5 and 10% of your population of mares that will be not pregnant or open following a season.
And these are the mares that we especially are talking about today, because we have maybe something that can help, but we'll get into that a little bit later. What is it, Miki, that in my announcement, maybe it's something they are overlooking? What are they overlooking?
So just to start with the beginning, because a lot of people that work with broodmares, they know very well that streptococci is a major problem in terms of infectious endometritis. So this is not something new. What most people, or a lot of people, don't know is that mares can also be infected without showing that they are infected. So we talk about this dormant infection or this hidden infection, where surprisingly many mares can have an infection that is not really easy to detect.
So the hidden one, the dormant, they don't detect.
No, it's at least it's maybe sometimes they do show that they have an infection, and then they treat, and then it disappears. But then when slightly later, then they actually find that they still cannot get in foal, and there they don't really see that they still have the infection.
I asked one of my vets that I'm in good contact with the other day, the oldest mare that our product has helped getting in foal, and she had a recent one was 24 years old. Do you have any recollection of any mares that your product helped get the mare in foal that is older than 24?
Yeah, it's mid-20s.
Yeah.
Whether it's 24, 25, that's probably some of the oldest ones.
Yeah.
And we've seen mares that have been open for 4 or 5 years as well. So, and those clients, they remember us.
And by open, you mean empty?
Yeah, exactly.
Empty for 5-6 years?
Yeah, something like that.
Yeah. My good contact said that she had one 4 year empty. But yeah.
I think an interesting point to this, because if you're 25 or 24 years old as a mare, you are really at the end of your reproductive season, or not season, your reproductive age. So it's a really old mare that you cannot really expect, because there's a lot of other things that could also influence whether she could get pregnant or not.
Yeah.
But we have several mares that are 17, 18, 20 years old that easily are helped with this treatment.
Yeah. It was just to make a point about how well our product works, and also that if you have a mare in your stable, barren, and she's 20,
go for it.
Maybe it could be a good idea if.
Yeah, sure.
So Miki, can you break down what dormant streptococci is, and why they are difficult to handle, and how they work?
Yeah, so normally streptococci grow readily on people. Usually grow them on blood agar plates, for instance, and they grow up from one day to the other. So they are quite easy to handle. So what is special about the dormant? This is a small fraction of the streptococci that somewhat shuts down their metabolic rate. So they almost do nothing. So they don't have a normal metabolism. And one of the issues with that is that most of the diagnostics that we use in the veterinary field is based on, in the clinical microbiology field, is based on growth. So it's based on the bacteria dividing and propagating. So when they don't do that, it's difficult to detect them. So this is one issue where you don't really see any growth. You take a sample, you culture it on plates as you normally do, and you often don't see any result at all. So from that you sort of conclude that there's nothing here.
So you would have a fake.
Yeah, false negative.
Yeah.
Yes, exactly.
And talking about these dormant streptococci, there was one thing that was quite weird to me when you explained me, and that's how they dig down in the mutual lining, or mucosa lining, is it called that?
Mm-hmm.
Yeah. Could you elaborate a little bit?
Yeah. So first of all, the mucosa in the reproductive tract is a quite complex thing. You have different ducts going deep into the mucosa. So there's a lot of different pockets where you can have mucus piling up. You can have bacteria hiding in these. But what we found in some of our early studies was that the bacteria are also able to get intercellularly. So they can actually basically get into the cells, the equine cells, and then they can hide inside the cells. And this can take place not only in the upper layer of the mucosa, it can also be quite deep into the mucosa. So it's that means that the infection can actually get very deep in the uterine lining.
How deep?
Yeah, we have estimates of 10 millimeters into it. So this is quite important in terms of if you some of the treatments rely on stripping the mucosal surface, and that is not really enough to clear the infection because it doesn't get that deep.
No.
So you will of course get rid of some on the surface and just below the surface, but you don't get into the very deeper parts by that kind of treatment.
So you're telling me that the streptococcus cells are eaten by the horse's cell, or?
Yeah, it's not eaten by. They actually, when the streptococci get close to the, almost hitting the surface of the equine cells, there is some kind of crosstalk between the bacteria and the equine cell, which makes the equine cell open up. It actually forms like some kind of cup-like structure in the surface, and then
So
the
it
bacteria.
opens up?
Yes, not like making a big hole, but it actually makes like a cup-like invagination in the surface. Then the bacteria get into that, and then it closes on top of that. So the bacteria resides in a kind of vacuole inside the cell, and that's pretty smart because first of all, the bacteria are then hidden from the immune system.
Yeah,
and they can actually But the thing is that the bacteria communicate with the equine cell and manipulates that. So it's like a clever way to disappear from the surface and stay for prolonged periods of time inside the equine cell. And here the bacteria are hidden from the horse immune system.
So it's both inside the cells and also deep down in the uterine lining.
Exactly.
Crazy. No wonder they are difficult to find.
No. That's exactly the main thing. They are so difficult to find. And also because if you look at how they are distributed within the uterus, you find pockets of infection. So you can have a bit of infection in the right horn, you can have a bit of infection in the left horn.
So these streptococci are really difficult to find when they are dormant. They are hidden inside the equine cells, and they also can be pretty deep within the uterine lining.
Exactly.
How are you able to fix the problem?
And you're totally right that they hide, and the amount of clinical symptoms that you will find in such a mare can be very limited. So there will be you'll have cases where there's no fluid accumulation, there's no discharge. So if you don't look for it, you won't find them. What we discovered was a resuscitating factor that stimulated growth of these bacteria. You add this, our product, bActivate, which is a resuscitating factor, allowing and stimulating the bacteria to grow. Before, they were located deep within the tissue in pockets here and there. But when they start to multiply, they come to the surface of the uterus and they are distributed throughout the uterus. So now it's much more simple to go in, sample the uterus, and you will recover a metabolic active bacteria, which allows you to culture it in the lab and identify which bacteria it is, allowing you to identify the best treatment.
And we to start with, we talked about them 100 mares, and you told me around 10% would end up being problem.
Yeah.
And within that group, the 10%, how many would have a dormant infection that you could activate?
Yeah. So when we compile data and look at large data sets, we see that within the group of problem mares, 80% of these mares are infected with dormant streptococci, this latent endometritis, and that goes on all breeds.
80%.
80%, yeah. And it's a wear and tear issue. You can see it's in mares that have more than 3 foals. It's in mares that have a history of endometritis, and mares that are more than 12 years of age. And in these factors, you don't need to be more than 12 years old and have had more than 3 foals. It's when we looked at the statistics, it's enough just to have one of these risk factors. So it's a very common scenario in a problem mare that you will see this.
Would you, from what you know, would you say that the percentage would increase if the mare is 12 years old and it's a problem mare? You say 80%. Would it then be a higher? Or
I would, if it's an 18-year-old mare that have been actively breeding, so we have been bred, foaled out, dropped the placenta, etc. Then, because the cervix has been open and there's been contamination of the uterus, there's also been bacteria that are capable of establishing an infection, and we know that it's a specific group of beta hemolytic streptococci that can do this. So you will see it over years accumulate, and the older the mare is, the more foal it have had, the higher the risk.
But you don't. So you don't know if it's more than 80 or.
Well, you would expect it to be more than 80 if the mare is 18, but
we don't know for sure.
We have many more. I mean, most of the breeding mares we have been looking at are comparably younger.
Yeah.
So the number of really old mares in breeding is relatively low.
The reason for my question is my understanding regarding these infections. These infections are building up over time, and
true. And
to my best knowledge, if you have an infected mare, it can also get involved.
Yeah. So this dynamics is actually more interesting in the other age, end of the age group. So
the young mares.
So what we expect is that some mares will get infected already with the first pregnancy or when giving foal the first time, because there the cervix is open, as Morten just talked about, and you have an exposure to the lower reproductive tract microbiota. So streptococci is an inbuilt part of that, and they get into the uterus, and some of them will most likely infect and cause a low-grade dormant infection. At this point, the mare is tip-top. It's doing well on all parameters, so it can also get pregnant. It can also run through the whole pregnancy, and it can have a foal. Next time, even though it has a low-grade dormant infection, next time it foals, then again it will get exposed to streptococci and other bacteria. So we foresee that the load is then you get another load of bacteria coming in, and so forth. It builds up, and this is where we talk about when the mare has had 3 foals or more, then you start reaching that threshold where the buildup of this infection is starting to nag in the uterine lining and trying to compromise.
And one of our goals is also to make people aware that this scenario is present, because we still, even though that we've been talking about this for many years, meet people that haven't heard about it. And when we activate the mare and we treat it, it gets in foal, and that is they can have spent years and a lot of money trying to get this mare pregnant.
I was when preparing a little bit for this, I was about to call this podcast "If Only Breeders Knew," because it is. I have not spoken to thousands, but I do speak with a lot of studs and vets, and they don't know. So
I think it's also a matter of priority. One thing is if people don't know about it. Another thing is if people know about it but really don't, prioritize to treat that problem. Yeah. And when I think about it, then if you have a mare that fits, it's a problem mare, it fits all the criteria that we have talked about earlier on, and you know that there is an 80% risk of it having such an infection, that's a very high chance of success if you address this problem. So I think instead of sort of waiting and trying sort of all the usual things, why not address one of the major problems that you can actually do something about? This is where I see there's a discrepancy between what people know or what they should know and do about.
Yeah, so people, the vets and broodmare owners, if they're looking into our product, we can pretty much promise them that they will be bending less circles, getting in foal, and also getting more foals.
That's for sure, yes. And also, we can promise that they will address a major problem right away instead of having to do, walk around the problem and not really getting anywhere, and then maybe ending up using our product in the end.
Yeah, and it's also important to keep an eye on the financial side, because it's not cheap to board a mare, and it's not cheap to have the vet come around. So it's important that the mare gets pregnant, producing a foal, making some kind of income. So time to pregnancy is of major importance.
One of your earlier studies that you did at Haggard Equine Medical Institute, and the study was led by Dr. Christina Lu. Can you explain a little bit how that study went?
Yeah, it was as you mentioned. You can say in the early days, I did a sabbatical at University of Kentucky, and spent half a year there. And while I was there, I talked to the vets at Haggard and introduced them to our findings, and that stimulated them to try it out in a selected group of broodmares. This was mares that have been barren for some of them for years, and they were very pleased with the results they saw, and since then they have used the product.
So how many mares were in that study?
Oh, let me see. It was I think we had 60, 65 or something like that.
All barren, or also
yeah,
problem?
all problem mares.
Yeah,
all problem mares. And it's been a while. It was in 2010.
Yeah,
as we started out.
Yeah.
So I think we had around 70% of these problem mares pregnant, and because we've done other studies that have the similar figures, and the majority of these mares foaled out, so produced a foal. So the fascinating thing when you work with these mares that you have been trying to get pregnant for years, and you activate them and you see that they change from being, you can say, dry and without clinical symptoms, and then it's like turning the hand, and you will see that they will have purulent discharge, some of them, fluid accumulation in the uterus, and you are able to recover substantial amount of bacteria. Then that was what made them say, okay, there's something about this condition, and there's something about bActivate.
Do you remember Christina Lu's reaction to the whole study?
Yeah, she was. I mean, we were all very pleased with it. It was,
not just pleased. I think we were quite surprised.
Yeah, we were surprised that it was so prevalent. I mean, it was, as mentioned, it was in the early days, and I was not aware that it was affecting that many of the problem mares, because we have only worked on research mares initially, and this was the first time we really looked into these mares, and it's also important to stress that these mares have been treated a lot. I mean, this was very high quality brood mares, and it was very important for the owners to get a foal. So they had intense treatments, and this group is, I mean, they're very good vets.
Yeah, exactly, and that was what I was going to mention. Haggard, world largest equine hospital.
Yeah, and the reproductive team there is extremely good, and that's theoretical and practically.
So it was 64 mares from Haggard that they were not able to get in foal problem mares into the study, and off they went. That's quite amazing.
Yeah, we were very pleased with that.
And you remember how many foals out of those 64? How many live foals were delivered the year after?
Quite sure it was 32.
32?
Yeah,
32
some were lost for follow-up.
But we know at least about 32.
Yeah.
So for sure you can say...
we know that was at least half of them were
delivered a live foal.
Yeah. And this was quite extraordinary.
And some of the mares were sold out as pregnant. So they were 5-6 months pregnant, and when they're that pregnant, the risk of them losing the foal is very low. But then they were lost for follow-up.
Crazy. if you have been struggling to get that mare in foal, keep listening. So now to just, because I when I talk to vets and broodmare owners, I hear often that they will be flushing with different stuff. Kerosene is they flush with, they are not shy, they flush with a lot. And sometimes they get lucky, I guess. Miki, can you tell me a little bit about why that is not really a method that will be good in the long way?
It's very important to stress that these different items they flush with are very different and work in very different ways if they work. So it's some of them are not doing much. I mean, so of course, if you flush even with saline, you will sort of clean up the inside of the uterus. So that has can have a positive effect just on its own.
Mm-hmm.
What is happening with the more sort of the compounds that are a little bit more active? If you take kerosene, for instance, that strips the mucosal lining completely. So you basically strip all the upper lining of the mucosa, and of course, if you have infected cells in the upper lining, you will also get rid of those. The problem here is that kerosene doesn't get into the deeper parts of the uterine lining or the uterine wall. So, and this is where we can still see bacteria sitting, as we've talked about already. So even though kerosene is a rather harsh treatment and do something, it is not a guarantee that you will actually get rid of the dormant bacteria further down in the tissue.
Yeah. And just as a comment to that, we've done studies in New Zealand where kerosene is a very common treatment in problem mares. And despite the very frequent use of kerosene, we had activation positive mares, so mares with this chronic dormant infection, had a prevalence which was similar to what we found in other places. So it's not the kerosene might help in some cases, but it's not the cure.
I'm under the impression that the kerosene treatment is pretty rough, and also that it can you can get the infections to be at a point where you are able to get in foal, but the following year you're gonna have trouble getting that mare in foal because you have chosen to use kerosene.
Yeah, it's still quite debated how harsh you can say kerosene is. I've seen cases where there was adhesions within the uterus, so scar tissue forming scar tissue, preventing the uterus from functioning normally. And without knowing exactly that it was kerosene, it was suspected because it had been used previously. Other vets say that you've used kerosene for years and never seen a problem. I wouldn't use it myself because there's other ways of dealing with these chronic infections, and there is when you do infuse a chemical irritant like kerosene. I mean, it's petrol, and it's extremely harsh to the tissue, and there is a risk that you will form scar tissue when doing that. And you can
that's a easy way, better way. Speaking about scar tissue, because that's also often mentioned as a reason for pregnancy not to be.
Yeah, exactly.
Yeah.
For the pregnancy to go to term, because if you have a lot of scar tissue within the uterus of a mare, uterus is not capable of supporting growth of the fetus throughout the entire pregnancy. And that is one of the things that can prevent a mare from producing a foal.
So, Miki, maybe you can help me understand how scar tissue
So it's a very generic reaction. So when you have an inflammation, for instance, when you have an infection, that creates an inflammation because it activates the immune system. And the immune system can also be quite harsh on your tissue. So if you have a chronic infection where you have a sort of a low-grade inflammation all the time, that can actually cause formation of scar tissue. And this is also something we see. This is very well known in brood mares that have been in the reproductive game for years and several cycles. This is you see a buildup of scar tissue. And one of our hypotheses is that this is basically something that happens in parallel with this hidden infection that builds up, and you see that this is a way of you damage the uterine tissue over years, and the quality goes down gradually. The older and the more folds that the mare get.
So if I had a racehorse and I started having one, maybe two foals with her, and then she was out racing for a period of maybe 5-6 years, would it be then a good idea to make sure she is clean before, so she don't go with a hidden infection for 5-6 years?
I think it's. I mean, we haven't made a proper study to show when does it make sense to prevent this kind of infection. But as we talked about in the beginning, we see a clear increase in the frequency of this dormant infection when the mare has had 3 foals or more. So I think it makes very good sense to, after it has had 2 foals, then maybe start to think about this as a preventative tool to make sure this dormant infection doesn't build up. Because it's not the treatment with bActivate or an activation treatment does not harm the uterine lining. So it's not something that is harmful to the horse. And therefore you can prevent this buildup of the dormant infection at an earlier stage than most people do now.
But if you keep the mare clean with no infections at all, she will, in the long run, have less scar tissue.
There's very much that speaks for that, yes.
Yeah, and you can say from a very practical point of view, if you have a mare that have had 3, 4, 5 foals, even though that it was a mare that gave foal early in the season, the first year, over time it might end up foaling out in May or June, and you decide to rest the mare over throughout the autumn and not breed. And that would be an excellent time, say on the Northern Hemisphere in August or September, to activate the mare and treat if you see growth of bacteria. And we have started doing that, being proactive and using this, you can say, spare time for something constructive. Yeah.
When I look at the list of things that can be prevent a pregnancy, that list is pretty damn long. But one thing, could you confirm that infections is number 1? Would that be correct?
I think that is very correct, yes.
Yeah.
It's when you look at problem mares and investigate them for different causes of that could interfere with the establishment of the pregnancy, infections in the uterus is number 1 for sure.
Yeah.
There are different streptococci is then the most common cause. And then there's a whole long list of different bacteria and yeast, for instance, that can also play a role in and impede the infection or the pregnancy.
So if you're interested in trying bActivate, Morten, what is necessary to fulfill a treatment with bActivate antibiotics? What is needed?
Yeah. It's very straightforward because it's procedures that are done in a regular reproductive equine practice. The mare is in heat. You sample the uterus. You, for example, using a low volume lavage. Then you infuse 10 ml of bActivate, like you would infuse a mare with antibiotics, for example. And you come back 2 days later. During those 2 days, if dormant streptococci within the uterus, they will be activated and they will multiply, so that when you come back 2 days later and do another sampling of the uterus, you will recover the bacteria if they are there or not. Then the following day, you will have the culture results from the first sample and the second sample, and that gives you a full picture of the bacteria present, and you can start treatment. And the treatment is similar to how you would treat another case of endometritis, uterine lavage, followed by infusion of antibiotics that you know that the bacteria are susceptible to. And if you have seen growth of streptococci predominantly in the second sample compared to the first, you know that it's been activated, and then you know you should treat systemically as well. Treat with penicillin intramuscularly for 3 days, two times a day. Short treatment period, but with a high concentration of penicillin, and it's very effective.
So just to be sure, you both treat in the muscle and you treat locally.
Exactly.
So this is quite important because you need to hit the bacteria both from the outside and the inside of the uterine wall.
Yeah. And why do we start with a?
This is because you need to know what's going on in the.
So you want to have a status.
Yeah, you need a basic status first, because in some cases if let's say the mare has been immunosuppressed so it has maybe got infected with a range of different. It could be mold, it could be yeast, it could be different types of bacteria at the same time. Then you cannot just do a bActivate infusion. You need to know what's going on before you start doing that.
Yeah, we have also other examples where we would isolate E. coli, for example, on the first sample, but only streptococci on the second sample. And I know that there's a risk that the E. coli is still there on the second sample, but simply because there's so many streptococci, they are outnumbered. But I don't want to be in a situation where I only treat the streptococci knowing that there is also E. coli there. So it's important to get, as Miki said, the full picture, so that you can direct your choice of antibiotics towards all the bacteria present.
So this treatment is 4 days?
3 days.
3 days?
Or depending on, if you talk about the antimicrobial treatment, it's 3 days.
Yeah, but I'm talking about from start to finish.
That's I mean, you have 2 days where you start using bActivate, then you wait 2 days, you do your culture, you know result after 1 day, so that's 3 days.
Yeah.
Until you know what's going on.
Yeah.
And then if it's positive, then you have 3 days of treatment after that.
Yeah.
So if you're sort of out early, in the beginning of the heat, then you can actually have it. You can finish the treatment, and then in some cases you can actually try to get it pregnant in the same heat.
Yeah. Is it important that it is precisely 48 hours, or can that be a little bit loose? Or
we have actually also looked into sampling already after 24 hours or 1 day.
Yeah.
And a large number of mares will be positive already at 1 day. So we saw a slight increase in numbers after 2 days. But
how slight?
I don't recall the numbers exactly. It
10% or something like that. It's not.
So you could say
some are a little bit, slow starting, but most of them are actually up being positive already after 24 hours. Maybe one comment more about treatment, because if you have, in the vast majority of cases, the dormant infection will be a streptococcus.
Yeah.
And from very large studies published over many years, it's very clear that these streptococci are basically always sensitive to normal penicillin. So you don't need broad-spectrum antibiotics to treat these. You can just use regular penicillin.
Yeah.
And this is very important, and this is based on thousands of cultures with streptococci. Several papers have illustrated this, that they are hardly ever resistant to penicillin. So
that was a little bit about how we use the product. So and now we get the mare in fall, and everybody's happy, and we deliver live foal. The year after, is she still clean, or what is your expectations for the following year? How long lasting is the method?
Yeah, we have had mares that have been activated, treated, bred, and got pregnant, and has worked as brood mares for years. But we have also seen cases where mares, they become reinfected very easily, and then it's necessary to activate them again and treat them again. I think what happens is that these mares that are chronically infected, they are less. They are more susceptible than other mares to become infected again. There are several risk factors increasing the chance of an infection to establish. So I would if it was my mare, the first time around, if everything looked good, I would breed it again. But in the back of my mind, I would say, okay, I have to remember to activate this mare sooner than later.
If I'm a client and my mare is activated, what should I expect? Her being clean again next year, 2 years, 3 years, 4 years? What is the average?
We don't really have numbers to support that, but
No.
what Morten was alluding to was this, that there's predisposing factors. So if, for instance, if the mare has a poor perineal conformation, there's a much higher risk that it'll get contaminated in the vagina with the fecal contamination, which also includes streptococci, for instance, or E. coli, and that will often spill over into the more deeper parts of the uterine or the reproductive tract. So it's difficult to say something general more than if they have predisposing factors, then you should be more aware of this and make sure to test earlier than if you just had a very young brood mare.
Would it surprise you if that mare kept delivering foals for 3 years in a row after treatment?
No, we've seen that several times.
So that's
actually, we have seen really problematic mares that were so difficult to get in foal, got activated and clean, and then they have been getting pregnant and foaling for several years after without any problems.
several years to me. That's 2 or 3.
Yeah.
Is
That's not bad. Sometimes 4 or 5 even.
Yeah. So are you familiar with 5?
Yeah, we have had some. The thing is that some of the mares that fits to this problem mare category are already, have a certain age. So if the mare is 12 years when it starts, and then it goes on for 5 years after that, then it gets into this quite old age mares that, for some different reason, may not be into or stay into the breeding, turn around any longer when it gets to 17 or 18 years old.
Just to jump a little bit into these risk factors.
Yeah. So we have basically 3 main categories of factors or risks that where we can see a clear correlation between those and being infected with a dormant infection.
So you can say this would be a high value advice to the vet.
Yeah.
Pay attention to this.
And also something quite easy to, these are very easy questions you can ask yourself. Is this mare likely to have a dormant infection? So one thing is it 12 years or older? So no matter how many foals it's had or anything else, if it's 12 years or older, then there's a very high risk that it has a dormant infection.
Yeah. And how high risk is that? The 80%
Yes.
Yeah.
Another thing we look at is if it has 3 foals or more. So again, that will also put it into the category of a very high probability of having a dormant infection. And the last major category is if the mare has had a kind of endometritis, if it has aborted, so reproductive problems, especially associated infections, then this is also very likely that you will see a dormant infection following that.
And is it all together? Is it
No, just one of them. I mean, 12 years or 3 foals or more, or a previous episode of endometritis or abortion.
So if you have a mare, she's difficult to get in foal, and she's 12.
Go for it.
Yeah. The chances of a hidden infection is as high as 80%.
Yeah.
Exactly.
It's crazy. What if she has problems and she's 9?
Well, you'd still have to keep this in mind. So the 12 years is just what we see from very many, from a high number of problem mares that we've looked into. And there are several studies that have documented that this age is actually a turning point. So you also have to imagine that getting pregnant is not just one factor. It's not just infection or not. It's a lot of other physiological factors, for instance, that all play in concert to establish this pregnancy. But of course, if you get a high-level infection, a high-grade infection early on, which can happen easily, then that in itself can be enough to antagonize pregnancy.
When speaking to vets, maybe more studs and owners, I often hear a biofilm. The mare has a problem with the biofilm. Is that related in any way to the dormant infections? And
It is somewhat related, but not fully. So a biofilm, just to define that, is when bacteria make a colony, a microcolony on the mucosal surface, for instance. So it's a superficial formation of a colony that grows. So the bacterial community establishes on the mucosal surface. They usually start to secrete extracellular matrix. So it's like a slimy kind of substance with a lot of proteins in. And what happens often there is that some of the bacteria inside a biofilm also get to be dormant. So what is often used is vets wants to break up this biofilm to get rid of it. And many people use acetylcysteine, which is like it's known to break up also in people. If you have a cold and you have you're coughing and whatever, you get a lot of mucus in your respiratory tract.
Are we talking slime?
Exactly, slime.
Mucolytic.
Yeah. Then acetylcysteine is known to have somewhat of an effect. What is important to remember here is that dormant infections are not just on the surface. They can be in the biofilm, but they also appear in the tissue. And there, acetylcysteine does not do anything. It doesn't get into the tissue. It doesn't get the dormant bacteria back into the active state. So you can use acetylcysteine to break up the biofilm to some extent at least, but it doesn't fix the dormant infection.
Would it in some cases help and then get the mare in foal, and then we have the problem again next year, or how does it?
I think considering that much of this problem is actually happening in the tissue, fixing the problem on the surface is not even halfway, I think. So I think it's a very easy treatment. It's not very costly, and you feel like you do something.
Yeah.
I think this is probably the feeling that most people have when they both the vet and the owner have after having used acetylcysteine.
If you have biofilm, do you also then have a dormant infection?
I'm not sure you can say so.
No.
I think it can easily be there at the same time.
Yeah. You told me that there would be probably dormant within the biofilm.
Yes. So you can have dormant bacteria within the biofilm, but it's still usually on the surface.
Yeah.
So it's a quite superficial problem.
Yeah.
And not, it's quite difficult or different to what you see in the tissue, which is where the real dormant infection is.
Such a biofilm experience, is that triggering the immune system in any way?
Of course, if you have, it depends a little bit on how active the bacteria are in the biofilm. So if you have it generally, if you have even a superficial infection on the uterine surface, then that will be detected somewhat of the immune system. But if it's a low grade, low activity biofilm, then there's not a lot of activity.
No. But the reason for me asking was, Morten, you told me quite interesting relation to the immune system awakening and then the egg being able to attach and these are things colliding. Could you?
Yeah, I think what you're referring to is the importance of the uterus to establish an environment suitable for the pregnancy to grow, and it's important in such an environment not to stimulate the immune system, because even though that you have a foreign body, you can say, an individual that is the embryo is different to the mare itself, it has to grow within the uterus. So it's a place where you will see that the immune system is down regulated when the mare is pregnant, and that is also a beautiful place to hide out if you're a bacteria. I think what happens in some of these chronic cases is that you have a battle between the low-grade inflammation present in the endometrium and the environment suitable for pregnancy, and that prevents the pregnancy from establishing.
So what I'm hearing you saying is it's a good idea to have the immune system calm.
Yeah, exactly. You don't want anything to prevent the pregnancy from growing. Yeah.
Because immune system would be capable of that.
For sure.
One thing that is, and this is also a principle that is used by other kinds of treatment, is that you sort of dampen the immune system. So you make sure that the immune system is not that active. The problem with that, because that makes sense to a large extent. The problem is if you have a dormant infection, which is very common, then you don't get rid of the bacteria either. So you sort of hold down the immune system and maybe too much. So what is happening when we activate with bActivate is that we actually provoke a quite fierce inflammation and get the bacteria to grow, but it's in a controlled fashion. So we know, you infuse bActivate, and then 1 to 2 days after you come back and you treat if the bacteria are there. So it's, in that sense, it's a controlled and not a long-term infection you provoke, but you do provoke an infection.
Yeah.
But you fix it quite quickly.
Yeah.
So the inflammatory reaction is also kept to a minimum, and you address it very quickly after. The bad thing is if you have multiple times of flaring up of these infections, and that sort of keeps the uterus in a low-grade inflammation, high-grade inflammation, low-grade, it goes up and down. This is also where you have scar tissue formation.
I wanted to ask you a little bit about a study you did in Ireland. Can you...
Yeah. So this was done at a big stud farm called Kildangan.
Yeah.
And we did it together with Mita Osborne, which was, she's a very experienced reproductive vet, and she worked on that stud farm, overlooking a lot of mares. And when we got to talk with Mita, she introduced the product. She was very open to try it out, but also a little bit skeptical, I think. So what happened the first season that we tried it out was that she pulled out 19 mares, problem mares, real problem mares. Some of them have been barren for some years, and as we've talked about earlier on, this was thoroughbred mares that were high value mares. So it's not so nice if you're a breeder to see empty mares year after year.
Yeah.
And having got a lot of attention, so a lot of resources put into these mares. So she was, and the stud was extremely interested in getting these mares back in active reproduction. So they were activated and treated, those that were positive. And so out of the 19 mares, 16 were positive for streptococci, and they were then treated with penicillin, and then tried to get in foal. This is with natural cover. So 14 of the 16 got in foal, and actually also carried through and had a foal the following year.
So 14 live foals.
14 live foals out of 19 in total.
That's crazy.
That was pretty amazing. Yeah. And also, especially because this was some of the really poor performing mares in terms of getting in foal. That was the worst of the worst. They had to. Exactly.
Yeah, and as I recall, the average number of cycles that these mares were bred was 1.2.
1.1 actually.
1.1.
So basically one
they
cycle.
Fall, boom,
yeah.
Right after.
Right after.
Yeah. And this stud is an international stud, isn't it?
Yeah, it's part of the Godolphin which is
Godolphin group.
So the best of the best.
I would say
in
so.
Throughbreed racehorses.
Yeah.
That's a nice study.
It is.
As a broodmare owner, you will be investing a lot of resources in getting mares in foal. How well is the bActivate method? Can you? How good is it?
Yeah, we just talked about some of the clinical data, but we also have some research data where we wanted to establish or answer the question: how effective is the bActivate treatment? So what we did was we identified 19 mares that were activation positive, and these mares were treated afterwards. And then we came back in the following cycle and did the exact same activation. So we wanted to see in these mares that have been activated and treated, how did they perform when they were activated again? And of these mares that were activated again, they were all but one of them had no growth following activation.
So just to make it clear, you started with 19 problem mares.
Yeah.
And you activate all of them and treated all of them.
Yeah.
So they were clean.
Yeah.
And you bred them?
No.
No. You just let them be.
Yeah. We when they were activated, then the following cycle we came back and we activated them again.
No. Okay. Yes.
And we did that to get an idea about what is the status of the uterus in these mares that have been activated, because we wanted to know, are they only slightly infected, or what is the effect of the treatment? And of these 19 mares that were activated and treated, when we activated them again, 18 of these 19 mares were sterile. There were no growth.
They were clean.
Yeah, they were clean. And one of them was activation positive. And this specific mare was only treated in the uterus because it was a mare that was a little bit tricky to inject. And it was during the weekend, and there was only one person there. So it was only infused with antibiotics.
So that mare was not systemic?
Yeah, it wasn't treated systemically.
Only local.
Yes, only local. And for me, it was just a very good example of how important it is to treat the mare systemically as well as locally in the uterus.
So one of the things that I, when starting in this business, I found out pretty quickly that the sensitivity of the different methods is quite different. And normally when I talk to vets, they all say swipe, but that isn't really the best method.
There's a lot of data.
There's a lot of data
documenting that the swap is not very effective. So actually, if you have 100 mares and you swap them and you know that they're positive, you will only catch around a third of them.
Yeah.
So
and this is not talking about dormant. This is just in general.
This is just in general, yes.
In general, swiping 130 mares, you catch
around 33%, or a third of them.
Yeah, 132 with that.
Yeah, actually, quite a few studies now. So it has been, and this is some of them are old studies, more than 20 years old.
Yeah.
So as opposed to that, you can use either lavage, so you flush the uterus, recollect the flush fluid, and then you can somewhat concentrate that and culture from that, or you can take a biopsy where you take out a piece of tissue from the uterine mucosa, and then you use that to culture on a plate. You can also use the same biopsy for histology assessment, which is quite handy. But flush and biopsy are more or less the same sensitivity level. Usually 2/3 will be
So out of those 100, we are now catching 66.
Yeah,
60 instead of
60 to 70% of those will be caught with these two.
Twice as good.
Exactly.
That's crazy.
Yeah.
Why does people use swipe then?
The swaps are used because it's a very easy procedure.
Yeah.
And it's so you get
probably low cost.
It's also quite cheap, yes.
Yeah.
But I think it's also a matter of ease.
Yeah.
You can very easily take it out. It doesn't cost a lot, and people are used to it.
Yeah.
So this is a very important point as well. Both the owners and the vets are very familiar with this kind of sampling. Some people don't like to take a biopsy, for instance, because you have to puncture basically the mucosal lining, and some people are a little bit afraid of that.
Yeah.
In horses, the lining is very thick, so it's very, very difficult to actually do any harm to the uterus. We have actually in some studies we've taken out quite a few biopsies on the same horse, no problem at all.
Yeah.
And the flush technique is maybe a little bit more difficult.
It's a little bit more time consuming.
It's a little bit more time consuming, and also handling this volume of fluid is maybe a little bit more difficult than the swap, but it's very much better. So we highly recommend to either biopsy or flush the mares instead of using the even though you use the two better methods, you will not always find, or very rarely find, the dormant streptococci. So this is an important point. You cannot you will very often miss the dormant streptococci if you don't use an activation medium like bActivate.
And that's because it won't grow.
Exactly. So the bacteria, both flush and the biopsy and swap for that sake, are dependent on bacteria growing. So, and if they don't do that, then you will simply not catch them by these three methods.
You can get more information about the subject on YouTube. You can search for bActivate and edemathitis. You will find some good and useful videos. We also have a bActivate Facebook where you can get more information, and of course also a bActivate homepage. So thank you for listening, and we'll be back with a new episode.